if the rest of the folks on the call would take a minute, introduce yourself, the organization that you represent. I mean, Mukami, we heard from you and I think you're joining us for the first time, but if you want to just take the ball rolling, say again the organization you're from, and when you're done, pass it to another person.
Okay, sure. Thanks, Tammy. So I'm Mukami Gatuma. I'm the community organizer for Staten Island Community Partnership. We do a food pantry each week on Tuesdays, distributing to about 50 to 60 families. And every other week for the past month or two, we've been doing like pop-up pantries in different parts of the North Shore just to try and reach as many people as we can. So thank you for having me, and I'll pass it to George.
George, you're muted.
Good afternoon, George Barreto, Associate Vice President of Community Access and Engagement at Community Health Action of Staten Island's Community Access Center. That's the food pantry at 2134 Richmond Terrace. And I'll pass it to Cesar Vargas.
Hey everyone, my name is Cesar Vargas. I'm running for Staten Island Borough President. I'm also an attorney and currently work in the New York City Council.
Pick somebody.
Pass it along to Lorie.
I knew you were going to do that. Hi, everybody. So I'm Lorie. I'm Cesar's colleague, also running for Staten Island Borough President. I am a small business owner. I taught in neighborhood schools here in the North Shore for 25 years. I am very interested in learning more. I was happy to listen this morning to the legislative forum from February of this year, and I'm really interested in learning more about what you all do and how we can help and be engaged. Thank you.
And can you pass it?
I'm going to pass it to Gloria Levine.
Gloria?
Yes, I'm here. Yes, I'm one of the members of the Hunger Task Force, as also the Staten Island Council of Churches. I pass it on to Nick.
Hi everyone, Nick Buse. I lead the government relations work at the Food Bank for New York City, and I'm proud to be a longtime outside participant of the Staten Island Hunger Task Force. I'll go ahead and pass it to Cindy Roberti.
Hi, I'm Cindy Roberti. I'm with Feeding with TLC, which is Trinity Lutheran Church's food pantry. The pantry's open every Saturday from 11 to 1. And we're looking to get the soup kitchen up and running again. And we'll start out with takeout lunches. So that will be starting soon, also on a Saturday. And Luann.
I'm also with Feeding with TLC, Luann Martin. We've been having trouble acquiring the license to reopen for takeout and the soup kitchen. Jack was up at the licensing bureau this morning. I was trying to get an answer for him as to whether we're getting that license. We open as soon as we have the license.
Okay, who? Pass it along. Luann? Pick somebody to talk next.
I don't know who else is on.
That's okay. Hi, it's Nishama. I'll go.
Nishama.
Nishama Marcus, JCC Staten Island.
I can't hear you very well.
And sad that today's going to be my last meeting with the Staten Island Hunger Task Force. I've taken a position closer to my home, and I'm very much going to miss working in the field of food security. Oh, I'm sorry, Nick. I thought I got everybody. But it's been such a pleasure, and I'm happy to
look for the latest.
As soon as we can. We'll designate someone to represent JCC's food pantry. We do distributions Monday through Thursday at the Manor Road location by appointment only. And we also do distributions at each of our 3 cornerstone locations, one at Richmond Terrace, one at the Gerard Carter Center, and one at the Toad Hill Community Center. I'll pass it to Daniela. I don't know if you went yet. I'm sorry.
Hi, Nishama. No, I haven't gone yet. Hi, everyone. My name is Daniela Damas. I'm with the New York City Commission on Human Rights, and I attend these meetings regularly, and I'm very happy to see all of you. And I don't know who has gone yet, but I'll pass it on to Jody.
My dear friend. I work at St. Mary, I volunteer at St. Mary's Episcopal Food Pantry, and I started working quite a while ago, and Kathy is our lead. So Kathy, I'm going to pass it to you.
I am from St. Mary's Episcopal Church. We have a small food pantry. We have a monthly distribution on Saturday mornings. Prior to COVID, we did a community meal, a monthly community meal and food distribution. So I think a lot of the people that came to us were coming for the social aspect of it and a sit-down dinner. It was always a home-cooked meal. Obviously, during COVID, we had to switch to a completely pantry distribution. And we're seeing about 45 to 50 families. We just do a single monthly distribution. A lot of neighborhood people are coming to us now, which we didn't necessarily have immediate neighborhood people coming to us. And we have a lot of people who have expressed a little bit of shame that they're actually online for food. So that's a little bit of a difference that we're seeing. Thank you. I don't know who hasn't gone. Oh, sorry. Go ahead, Tammy.
I was going to say Adrian hasn't gone, maybe.
I haven't gone either, Neil.
Okay,
Neil, why don't you go first and then I'll follow you.
Yeah, my name is Neil Berry. I represent Mount Sinai. We've been a member of the Staten Island Hunger Task Force for over 15 years. We also currently do a pantry out of there. Also a member of Occupy the Block. You know, I wear a lot of hats as I'm wearing it right now, but I'm glad to see everybody here. Hopefully we can get some things moving in the right direction. Thank you. Thanks.
Hi, I'm Adrienne Abadi. I'm with the Staten Island Partnership for Community Wellness. We're a public health nonprofit. We support an initiative called the Child Wellness Initiative, which is working to increase access to fresh produce and reduce the burden of chronic disease. So I know members of my team have been part of this. I haven't been here in a while, and I just miss everyone, and I'm happy to be here today. I don't think Laura Jean has gone.
No, I haven't, Adrienne. Thank you very much. I'm Laura Jean Waters. I'm with the Staten Island Foundation. And I come to these meetings fairly regularly because it's such an important intersect between grassroots pantries and service providers. And I'm really happy to see some of our candidates here today to learn, like I do, about the needs of the community that we serve. Hina, have you gone?
No, I haven't. Thank you so much. Hi, my name is Hina Naveed. I am Cesar Vargas's campaign manager in this current capacity, but I know many of you from my former capacity at Siemens Society for Children and Families, where I was the medical director there. So it's so wonderful to see so many familiar faces, but today I'm here with Cesar Vargas. Thank you. I will pass it on to Sal. Have you gone yet?
No, I haven't. Thank you for the introduction. I'm Sal Albanese. I'm the Democratic candidate for the City Council in the 50th District of the Mid-Island. Quick background, public school teacher for 11 years, actually an immigrant. I came here from Italy at the age of 8, taught for 11 years, served on the City Council for 15 years, representing a couple of neighborhoods in South Brooklyn. And for the last 24 years, I'm a lawyer with a finance background. So I've been, I'm still practicing law and working on some finance issues. But I thank you for inviting me to this discussion, because I think the issue of hunger is underestimated. I think it's a deep problem and growing, especially after COVID. So I'd like to learn a lot more about specifically what is happening on the island on this issue. Thank you.
He went on to say, quote, the project will significantly
I'll
reduce.
pass it on to, I think I saw Mike Schnall there, one of the city council candidates.
Hi, thanks, Sal. Hi, everyone. It's good to see everybody here. Hopefully we'll be back in person soon. So first off, I want to say that I always take my lead from folks like Susan and Ginny and Johnny and Reverend Troya and Adrian when it comes to food insecurity and a whole host of other issues. I've been involved with them in all sorts of capacities with the Child Wellness Initiative, with SIPCW, you name it, over the years in my time in government, whether it was in the city council, and specifically for 10 years at New York City Parks, first citywide government relations, but more importantly, the last 5 years was the chief of staff for parks. And so I got to use our parks facilities, our staff to benefit folks in underserved communities that were suffering from food insecurity or didn't have access to healthcare. We were able to leverage a lot of those resources to help these various different networks do things. The last 5 years, I worked at New York Roadrunners as the VP for Government Relations and Community Investment, and we were able to invest millions of dollars into refurbishing.
Manister Craig or Craig Manister.
Oh, okay. Refurbishing schoolyards to playgrounds, using running and walking as a way to get folks healthy and well. And I'll just say this as a candidate, I've noticed that there's a lot of conversation about health, and it centers around the need for a public hospital. And some of the other candidates have caught on to the idea that I initially pushed back in January, is that having a public hospital or the resources of a public hospital are just a small piece of a larger continuum of health and wellness. It includes mental health, it includes access to fresh food, it includes activity, both passive and active recreation. It includes open spaces, it includes clean air, clean water, and solving a lot of our environmental justice issues. So I'm happy to be here. I love listening because I'm just learning so much. And if elected to the city council, I will lean on all of you to provide your expertise to help me make decisions that help you do your jobs better. And I'll throw it over to Amoy Barnes, one of my fellow former Parkies and a colleague of mine running in the city council for the city council too.
Good afternoon, everybody. Thanks, Mike. Good to see everybody. Thank you for inviting all of us here today. My name is Amoy Barnes, and I am also a candidate for New York City Council in Staten Island's 49th District. I want to say first and foremost, thank you to everybody for all the work that you do. Special shout out to St. Mary's, because that's my church. That's my neighborhood church. That's where I grew up. Hey, Kathy. Hey, Jody. And I say that because, you know, when I think about the work that you guys do and when I think about the work that we're all doing, it's all about do unto others as you want done unto you. It's all about giving. It's all about helping. It's all about making sure that, you know, we take care of each other and we take care of our neighbors. When we think about food insecurity here on Staten Island, I think a lot of times I always think about the statistics, which is in an average community, there's a grocery store for usually every 9,000 members of that community. Here on Staten Island, there's a grocery store for every 17,000 members of the community. That goes to show you that pretty much here on Staten Island, specifically in the North Shore, we are food insecure. As a borough, we are food insecure. So believe it or not, all of us are food insecure. That's a problem. That's a part of the work that your elected officials, your representatives are supposed to do. Looking at a community and saying, how can we do better to improve people's quality of life? How can we do better to support the needs of people? And as a person who works in education, people always say to me when I'm talking to them, they say, what are your top 3 issues? And I say, I want to remind you of something. Everything is connected. And I use the examples of education because I look at our young people and the young people that I work with. A young person can't learn if they don't have housing and a safe place to live, if they are hungry and they don't have food to eat, if they're not well and they don't have access to healthcare. So I always want to remind people that all these things are all interrelated. But most importantly, we always have to make sure that we're providing food, efficient opportunities, especially in a borough and especially in the North Shore, which is extremely food insecure. During COVID, working with so many mutual aid organizations, sorry.
Okay, we have to move on. Sorry.
Yeah, that's fine. That's what happens when you end up being last. Everybody just kind of like.
Okay. Terry, you don't need any introduction, but you introduce yourself.
Hi, everybody.
thank you, candidates, for being with us. And I wanted to put out two issues to you as part of the Hunger Task Force and part of a group called Food for All, which has been really working on some of the national legislative issues regarding hunger issues. People experience food poverty. A large piece of that is that they put all of their money towards maintaining a roof over the head for their families. And the cost of housing in our borough is skyrocketed. And I want to put that out there, that people are paying $2,500 for a 3-bedroom apartment with no additional heat or hot water covered. And that's the kind of level we're talking about. I looked at a house this weekend in the Port Richmond area where a married couple about to have a child are paying for 2 rooms, $800 for each room, $1,600 for 2 rooms, and the 3rd room in that apartment is going to be leased to somebody else. $2,400 that 3-room apartment will get. Would be great to hear from the candidates in this course of today. What is the solution to the affordable housing crisis that precipitates people having to take money and food out of their children's mouths in order to put it towards rent? And then the second is
Terry.
Yeah, I just want to put that out there.
Yeah, well, we'll come back to that.
Okay.
What we need to do is invite the candidates. We asked them all to be prepared with questions for us, so that we can. Hi, Olivia. Cesar, you have the tightest deadline. Do you want to ask your question and we can try to answer?
Yes, everyone, thank you so much. I apologize that I have to go, but I'm definitely committed, as so many of my colleagues have said, at least for myself. I've worked at the city, state, and federal level with governmental experience at all those 3 levels. And for me, one of the most disappointing things that I saw during the height of the pandemic in April of 2020, when the mayor announced $25 million for emergency food funding for food providers, and none of that money came to the organizations on Staten Island, and it went to the big name organizations, including World Kitchen, that at times don't have the direct connection to our communities on Staten Island. So for me, I'm definitely committed to ensure that we're addressing all the discrepancy of how Staten Island does not have its fair share of funding when it comes to food security. And as Reverend Troya said, housing security and an environmental crisis that at times the North Shore and different parts of Staten Island has. So for me, I'm definitely committed to leveraging my experience to ensure that we get our fair share of funding from the city, state, and federal level, as well as partners. So my question, yes.
Your question.
So my question to the members is when it comes to particularly with the borough presidency and governmental partners, what is your experience as they leverage the different levels of government, right, when it comes to ensuring that we are addressing the food insecurity that has been completely exposed and exacerbated by the COVID-19 pandemic?
Terry, you want to answer that?
Say it again, Cesar.
I was mentioning about what has been the experience and recommendations that you all have for a borough president to leverage different type of resources from different levels of government, including private partners, and what can be done better that you all see best to address the food insecurity, to address housing insecurity, as you said, Reverend Troya. So, because all those things are interconnected. It's not just if you don't have food.
So on the food insecurity issue, a large majority of the money that has come from the federal government has been through USDA boxes at the state level through a program called Nourish New York. All of it has resulted in putting food out there, but there's been no corresponding infrastructure support to pantries to get that food out there. And as a result, you have incredible amount of fatigue among volunteers and a shortage of volunteers as a result of the pandemic, because most of our pantries rely on retired people to be the structure of moving forward the food into the community. And just today, I watched one pantry give 2 freezers to a church that didn't have any freezer space. I watched on Friday night a very large donator of food and charity drop off 10 pallets of meat at 9 p.m. at night to a church that was already closed because they needed to get rid of the meat. And I watched Stapleton UAME organize themselves in a frantic effort successfully to give out all that food to the community, 10 pallets of frozen meat between the hours of 9 p.m. and about 2 o'clock in the morning. But that shouldn't be the burden of a church or of any of our small pantries or even larger pantries where there's not that infrastructure piece. So I would say that the government needs to build infrastructure in to the pantries in order for them to be sustainable going into the future. And that's very important. The other piece is that there's got to be a commitment to build more affordable housing, and that's an infrastructure piece. What they're doing with the rental assistance is to pay back rent, but that doesn't move the housing crisis forward. It doesn't end the housing crisis. There's got to be a commitment, especially in the 49th district, to have a plan to build very low income affordable housing for people in order to address that infrastructure issue that can end food poverty.
Thank you.
Do you mind if I add something? I just think that it's also important that representation is at the meetings, because I think that we often have like the legislative breakfast where elected officials will listen and provide support, but it's less ongoing than I think we need. It needs to stay at the forefront.
Thank you. Sal, we'll go alphabetically at this point. Sal, what's your question for the members?
Yeah, I think some of what I was going to ask has already been pointed out. I mean, food insecurity, hunger is related to the lack of living wage jobs, the lack of affordable housing. Everything is interconnected. I think that what Terry pointed out is what I'd like to know more about, which is volunteers are great, but you do need an infrastructure to coordinate volunteers to make sure that things run smoothly. And my question is, what are we talking about when we talk about infrastructure in terms of hunger of these pantries to make sure that they work efficiently? What are we talking about specifically when we refer to infrastructure? Terry, maybe Terry has that. I
don't mind answering. I think we all are going to have the same response. I think staff to support and coordinate the volunteers, to handle the, the monies in and out, the space, transportation, equipment. I think that, so many times we open because we want to provide a service to the community, but there's no grants that support those things.
Well,
grants, I can tell you for JCC, like usually we have, $25,000 to $50,000 worth of food grants, and not one of those grants supports a staff person. So this year during COVID, everyone provided food dollars to expand our pantry. We had somewhere between $150,000 and $200,000 worth of food. But the expectation is that the onus is going on the nonprofits to make it happen.
Well, that's not good. Let me follow up. Is there a prototype around the city that has an infrastructure in place that is doing a good job with distributing food and organizing? Is there a model that we can emulate anywhere around the city? Or are all food pantries similarly situated where there is no infrastructure? It's all a volunteer operation.
I'm going to defer to Nick and Terry on this one. Are you asking if there are CBOs that have a prototype, or if you're asking?
No, I'm asking
agency like throughout, like nationally, that has a better infrastructure.
I'm asking which nonprofits out there, if there are any, that are engaged in food distribution, pantries, things of that nature, around the city that have successfully been able to have an infrastructure in place, and sometimes you don't have to reinvent the wheel. Just look around, and there are models that we can emulate. So that's what I'm asking, if anyone knows of such a model.
Yeah, actually, Nick Buse might have an answer, and then Nathaniel might have an answer from the city. So Nick, do you want to talk?
Yeah, so thanks everyone for the questions. So the dollars for capacity and infrastructure, the term that we're using, are the hardest dollars for every local community-based organization to fundraise, to access, to administer. When it comes to administering city, state, or federal dollars, the contracting process in and of itself for those things is elaborate and involved. So I think there's a couple pieces to it. Is number one, make sure that those dollars are available in a flexible way that can go directly to community-based organizations to pay for the things like staff, space, transportation. And also not only increase the indirect rates and the rates that are available for those types of supports and operational supports, but ease administrative burdens. And that's really, I think, significant too, is that the easier it is to apply for and access those funds, the more successful community-based organizations will be in doing so. There are, to answer your question in terms of models, and most organizations can probably speak to this, is that the other significant challenge that every community-based organization has in New York City is that they're triaging so many different types of funders. So there's many, many, many models. What is most effective for a specific organization might just depend on the specific organization. But I will say that the city council's discretionary funding has been really key. I know that in terms of how the borough presidents have navigated supporting agencies, that can look lots of different ways. But there are some models for it. But I will reiterate what Reverend Troya and Shima are saying, that these are hard dollars for community-based organizations to access.
Mm-hmm. Jerome, did you want to add? Did you get the question?
No, I'm sorry. I just was able to join from a meeting that ran a little late. Is the question about how can the city support emergency food operations?
From a capacity and staffing point of view. And Jerome is from City Harvest. Yeah, sorry I'm late, everyone. As Susan said, I'm from City Harvest, Director of Policy and Government Relations. And yeah, just to underline a lot of the things that Nick also brought up, I would say one thing that would be incredibly helpful for the programs that we work with and that we've gotten feedback on is that for there to definitely be a little more flexibility in terms of how different city dollars can support their work. For example, we've had agencies that have had issues with just physical infrastructure or issues with even waste removal and sanitation, those sort of things you don't really think of. Of course, definitely keeping the lights on during the pandemic have been an issue. Figuring out if they want to transition from a paid staff model as opposed to a volunteer model. And quite often, the funding that we can connect them with from the city may not allow for that level of flexibility. So just definitely having like more options for them to be able to do that would be very important.
Can I just jump in? Thanks, Jerome. I think it was Cesar. I'm not sure if he's still on the call. I just did want to clarify one important part of this because it speaks to this question. Which is that early in the pandemic, the speaker and the council and the mayor did announce a $25 million fund for citywide emergency food as a supplement to other existing programming. This was really important because it actually fits this model that we're talking about. It was flexible funding. And Cesar noted that the funding went to larger agencies. I just want to clarify. The larger membership organizations in the city were tasked with administering those grants. So we administered them through direct payments or through food grants and things like that. But it's not that whenever we work with funds that come to us, we are necessarily passing that on in terms of food or other things like that to community-based organizations that are part of our networks. So it's good funding. That model of funding doesn't exist in the current executive budget that's on the table. There are some other types of funding that are important, including EFAP or the Emergency Food Assistance Program. as well as PFRED, which is a pandemic food assistance program. But that model of flexible funding that came through as an emergency measure is one of those examples of a appropriate model. And I think we as a community can advocate for that type of funding going forward.
So Nick, what you're saying is that the $25 million with allocation, which was flexible, if it was made a part of the executive budget on an annual basis, would be very helpful. Correct?
Yeah, that's right. That's right. Yeah.
Good to know.
Thank you.
I'd just like to say though, and Nick is a terrific partner, and some of his colleagues at Food Bank and City Harvest are really great partners, but we do hear incidents where funding to citywide organizations or programs that are meant to help all the boroughs somehow or other don't get to Staten Island, that there are certain issues about our isolation and transportation. There was a program during the pandemic that local chefs or restaurants were supposed to be able, and somebody hop in because
the restaurant revitalization program, maybe.
But food couldn't get across the Verrazano. So some local chefs who signed up to cook for people weren't able to obtain the resources. So I don't know enough. I know that there are problems and I hear anecdotes. So these are the kind of things that a borough president or a city council person could help by doing a little investigation or data collection to really understand how citywide programs impact on a local level.
Yeah, especially our local. Amoy, you're next. What's your question?
So what I'd like to know, well, I kind of have a twofold. I'm gonna try my best to keep it quick. I'm really curious about food waste and how food waste plays a role in how we actually work with restaurants and different organizations to make sure that the food gets to people, because that's one of the things I remember when I worked in the food industry years back when I was in college, how much food got wasted. So I want to know if there's been any work around that you guys have worked on, and the top 3 things that you would like to see from your future city council member.
Jerome, do you want to answer that one to start?
Yeah, sure. So City Harvest, particularly, so let me back up. So before COVID, we were on pace to rescue and deliver free of charge about 64 million pounds of food. And then given the immense need during COVID and influx in new donors and, to your point, surplus food in some instances or canceled events, we had actually rescued over 140 million pounds over the course of COVID. So our high goal of 64 million, we basically out-rescued by more than twice as much over the course of the pandemic. And a lot of that work is centered on picking up this surplus food or, cosmetically for a reason it can't sell kind of food, or food that's just being donated from farms, a lot of restaurants and farmers markets and food retailers. And those restaurants, some of them are actually on a food console that we have, where these folks that run restaurants are basically building their business sort of waste management. I don't like to use that word waste too much, to make sure that they're providing for emergency food operations as well. So that's kind of like built into our operational model, and we're continuing to rescue more food through that effort. And I think the second piece of your question was kind of like city council facing, or like the future of that kind of work. I would say we're sort of looking at ways where, so most of our food we're picking up is national. It's coming from farms or large manufacturers outside of New York City. And then probably 30% of it is actually being local. And one thing that we partnered with the city on was the restaurant revitalization program, where we were not only picking up food from certain restaurants, but those restaurants were also getting compensated from the city to maintain staff during the height of the pandemic when people were getting laid off. And they were also increasing their wages to go from tip wages to minimum wage. So I kind of use that as an example of, as we're thinking about like innovations and how we can do this work with like even more values and in partnership with City Council. It's about not just reducing food waste, but also reducing food security by, taking care of those that take care of their neighbors through the food donations as well.
Thank you. Hey, George Barreto or Kathy or Jody, do you have answers to that question as well? Anybody else?
To the three issues, yes.
Oh, Terry, sorry, yeah.
So Amoy, to answer your question, the three things that I think are really important, first is, of course, the infrastructure of pantries and developing a baseline in City Council, a baseline budget to create those infrastructures ongoing in the pantries. And that's everything from capital equipment like freezers, but also the need to pay the utility bills that keep the freezers, keeping the food cold, for example, as well as staff and trucks and all that goes as part of infrastructure. The second is, again, I'm going to say the word affordable housing. It's not in everybody's agenda that's a candidate for the 49th, but I think it has to be, because until when the evictions the moratorium gets lifted, you're going to have more people on the streets in Staten Island and more people in traumatic poverty as a result of losing their housing because it's virtually unaffordable. And then the third thing I want to address is the issue that Mike raised on the medical system and the healthcare system and the burden that becomes, especially the bills when you go for healthcare. It's important to understand that when a person goes and receives medical care in one of our hospitals in Staten Island, even if they qualified for some kind of a charity care, if they were uninsured, they not only bear the burden of their emergency room bill, they also bear the burden of any doctor's bill. So there's this perception in the minds of people that I keep hearing that if we just give money to our Staten Island hospital, that's going to solve the problem of poor people not being able to get quality health care. It's not, because they're going to walk away with $17,000, $26,000, $40,000 in medical bills from the doctors. Whereas in a health and hospital system, those costs are absorbed by the system. That is a very important point that I have never heard anyone address publicly, which is why the public hospital issue is so important. I'm not saying have a public hospital on Staten Island, but they have to create a way that is seamless in continuum so that people can get to the public hospital at Coney Island or at Bellevue on an ongoing basis in some kind of systematized fashion with as much specialty care as could be had on Staten Island, so that you don't have to go for one-day service there, that it can happen on our borough, and that the bills are then absorbed by health and hospitals whose mission it is to care for the uninsured. I just want to say throwing money at the hospitals is not the answer, and people bear the costs of those bills that impact their family food on the table.
Thank you. Okay, Olivia, can you introduce yourself and you're the next person with a question.
Yes, hi, apologies. I had this as 3:30 originally and I was in a student meeting, I apologize. So my name is Olivia Drabczyk. I am running for City Council in District 51. I am a first-time candidate. I'm currently a school teacher in my 10th year, so I work in the district. I'm a special education teacher and I live in Great Kills. I'm hearing a lot of things and it's making me think of a lot of questions actually that I wasn't originally planning on, but hopefully you haven't covered this before. But I think often what I had come to this meeting hoping to ask was that there's a perception that food insecurity doesn't affect the South Shore, right? There's this perception, possibly not shared by people here because you have more intimate knowledge, but that it's not necessarily a South Shore issue. In your experience, is that the case? If not, what is the South Shore's role still in this, and how does an office of the City Council person support you in destigmatizing?
That's a good one. Who wants to address that one? George, do you see South Shore people?
Yes, we do actually, and our mobile food pantry actually goes all over Staten Island, and we find that all over Staten Island there are meal gaps. South Shore, North Shore, even people coming to our pantry from different parts of Staten Island, all zip codes from 10308 to 10309, 10306, 10305. We see everyone from Staten Island. So I think people do have a misconception that there are no meal gaps on anywhere other than the North Shore, but there are.
Yeah.
Thank you.
And Terry, you have trucks going.
Oh yeah, we see it. Yeah. I would say we see a strong along the waterfront. So South Beach, Midland Beach, Newdorp Beach, Oakwood Beach, Great Kills area. We're out in Cottonville. You see a lot of seniors. Berry Homes is probably our largest stop. I would say we do about 125 to 140 families once a week at the Berry Homes, which I know is not South Shore technically, it's Mid-Island, but definitely Tottenville. Tottenville has a lot of senior poverty. That's fairly obvious. Prince Bay Reformed Church has a soup kitchen program and has had a pandemic food pantry over the course of the many months of 2020, and saw that impact on the South Shore as well, especially when people lost jobs.
Yeah. So
Nick or George, George and then Nick.
You're muted, Nick, George.
Sorry. I did want to say, I think it's important. Terry brought up something that, brought up a memory of mine. But the Berry Homes is one of our mobile food pantry stops. And one of the things that I heard that was really it really hurt me, is that there are seniors in the Berry Homes that actually depend on eating cat food because they don't have food at home. And I don't think enough people know that there are things that happen like this, throughout New York, throughout everywhere, but in Staten Island, I don't think people realize that things like this happen. You have people who can't get food who are eating cat food.
Yeah. It's going to follow up really quickly as well. Thank you for answering that. I know a lot of these are mobile, and I know South Shore Community Food Pantry has popped up and been working with them to try to get some 501c and city contracts. SNAP and WIC streamlining that process to support with not just waiting for a mobile pantry. Would that be a helpful thing for a city council office to provide in terms of supporting folks in accessing and streamlining applying for benefits?
Nick, did you want to say something to that or to?
Yeah, I can speak to a couple of the ideas that have been raised. So, in terms of how we think about community need, I think folks are talking about these mobile programs in part because there are few physical locations in that part of the island relatively to even Staten Island, which has maybe more spread out services. But because of the strength of the Staten Island emergency food providers, community-based organizations, they're working very actively to expand the reach. So I think that your idea of continuing to fortify existing community connections that community-based organizations have is exactly the thing to be doing, is to leverage those partnerships with community-based organizations. And I think to the second part of your question, and community-based organizations will answer this, I'm sure, which is that part of their work is doing benefits access, is connecting people to that work. Now, some offices of council members have some success in helping constituents navigate benefits processes, and sometimes that elevation can be effective. But you will also probably know that the process can be very involved. So there's not only the application process, but also the recertification process. If someone has a problem with their benefits, they're entitled to a fair hearing. Sometimes that fair hearing is the effective thing to do. Sometimes that's less effective than going through a resolution process. And community-based organizations often have staff or volunteers who are explicitly trained on navigating those resolutions, which often resolve cases much more quickly than the fair hearing process and doesn't bog down the system. So What I'm saying is, I think the issues that you're raising are significant issues. SNAP and WIC and benefits programs are incredibly powerful anti-poverty programs. They are the first line of defense against hunger, and it's really food pantries and soup kitchens that are that last line of defense. But the powerful and incredible thing about the CBOs on Staten Island and really across the city are that they're fighting on both of those fronts. So in terms of how we resource those organizations to fight, we want to make sure that those CBOs are funded to do that work.
Just to mention that there is St. Edward's Food Pantry on the grounds of Mount Loretto, which has been a riveting force in that community, stayed and steady over the course of many years. But also to mention that in the Richmond Valley area, where Ron Castorina's office was when he was assemblyman, we had discussions and had actually had a plan to go in and provide WIC and SNAP services at his office so people could come and then people would get an emergency bag of food to go. So while it wasn't a food pantry, it would have provided an office environment where people could come and begin to the process of securing additional benefits. But there was a shyness to worried that this would upset the neighbors if they knew that people were coming to process food benefits. And ultimately the decision was made not to have us bring somebody out once a week to help people with applications. But if there was an elected official that opened their office on the South Shore just to help people become aware and fill out these applications, that would go a long way to provide some level of food security outside of an emergency food bag. And that's really the way you want to go.
Lorie, do you have a question?
Yes, I'd love to. Thank you so much. I wanted to follow up on the information that I got when I was reviewing the legislative forum that you guys held in February. That had to do a lot with the stimulus money and education around what officials and what the public might need to know. And you've educated me so much today and always. So I heard a phrase that, and this sort of dovetails with Olivia, but sort of ending hunger through federally funded programs. And I was so intrigued by that phrase, I wanted to follow up on it. So how do we as elected officials, how can we be used as trusted messengers to deliver proper information, to support and give updates to the community and to our constituents? And how do we end hunger through federally funded programs?
Who's ready to do that one? It's really important.
I want to say Nick. I really enjoyed your chat and your portion of the forum that I watched, but I'm open to everybody, of course.
Sure, I can take a start at it. And I apologize, my computer froze for a moment, but I'm not sure what came through, but I just wanted to say CBOs are fighting both on the first line of defense and the last line of defense. So in the benefits space and also in the emergency food space. So when it comes to resources, that's a powerful way to make sure that community members have access. Your question is complex. When it comes to federal, the accessing federal benefits, local elected officials, community leaders do have a lot of role to do the community outreach, connection, and advocacy. I think one thing that's really powerful is for us to remember that New York tells the story of the nation often. And I think that, we can, the more that we tell the story of the power of these federal anti-poverty programming, the more we as a nation understand that we should continue to be advancing, we should be proud of all the work that we do, because we have incredible national programs that need to be extended. So SNAP benefits, for instance, it's an incredible program. People can go to the grocery store, buy food that makes sense for their household. Now, eligibility is limited. Not everybody qualifies for it because of income or many other things. The benefit levels themselves are often insufficient. And we know that more people go to food pantries and soup kitchens at the end of the month, for instance, because those benefits are insufficient. So I think that, using our voice and using our progressive values to advocate for the expansion of eligibility, the expansion of grocery benefits. There's an incredible thing that happened during the pandemic that we haven't really experienced before, which is the PEBT program, the Pandemic Electronics Benefits Transfer Program, which is the grocery benefit for families with really all public school children in New York City, because all public school children are eligible for free school meals. So the more we can tell the story of that power and the power, for instance, of our Universal Free School Meals program, and make sure that our families are accessing those benefits locally, I think that's a powerful way to leverage federal programs and advance them. I know lots of folks will have other things to say. I'm sure Jerome does too.
Jerome, I can't hear you. Jerome? Oh, there you are. No, you can't hear you. Why is that? Well, let me just add, I don't have the numbers, but what's interesting is that SNAP and WIC support very, very, very many more people than pantries do. And it's more important to have more SNAP and WIC than it is to have more pantries. And I think it also, I think the pantries ought to be we should be putting ourselves out of business. Which is, I think, one of the things that Terry's talking to. Pantries are not the best solution to hunger. Anybody else?
Hi, Susan. This is Keith Carr with City Harvest. So I'll agree with you and just add some more color commentary that, a lot of our advocacy work around benefits is to really increase utilization of SNAP, increase utilization of WIC. WIC is grossly underutilized throughout the entire city. And a lot of it is, just their marketing of it and not having enough WIC centers in specific communities. The same thing with SNAP. Particularly over the last year, a lot of the enrollment centers shut down because of the COVID crisis. And then they relied on the pantries to sort of fill that gap. But if you don't provide funding to the pantries to do that sort of enrollment work and that outreach work, it's hard for them to do that on a volunteer basis. So, one thing we definitely advocate for is just more dollars for SNAP and WIC outreach, as well as all the other benefits, whether it's farmers market nutrition program and health bucks, anything that provides more buying power to the people that we serve. It alleviates the line at the pantry, and it alleviates and just puts the pantries free up money by getting free food and other items. It frees up your pocketbook, your wallet to purchase things at a grocery store. Then adding that with SNAP and WIC. It really moves a lot more families away from the hunger that we all see them facing. So, yeah, definitely something that we advocate for.
I'm sorry, can y'all hear me now?
Yes. Yeah.
Okay, perfect. Sorry, that's always fun with virtual work. But yeah, just to piggyback off of what Keith and Nick said so eloquently, food banks continue to recognize SNAP as the first line of defense against hunger. For every meal that Feeding America Food Bank, and Feeding America is the national network of food banks. So for every meal we're able to provide, SNAP's able to provide access to over 9 meals. And it's also an economic stimulus because that money is being spent in your community at the stores you want to shop at, and being able to purchase the food that you want at your own time, as opposed to kind of being at the mercy of like the schedule or the physical location of a pantry. So that's, as we kind of look at federal benefits, SNAP and definitely WIC, which continues to be grossly underutilized, are very important pieces to really shorten the line as emergency food providers continue to feed the line. Another thing that I have been doing more work to kind of draw to people's attention is that SNAP is, it's a federal program, and oftentimes it's regulated under this bigger legislation called the Farm Bill that happens every 4 or 5 years. So the next one isn't coming around, I don't think, until like 2022 or 2023, actually. So there's quite a bit of time. But there's a lot of work that can be done locally in between that time. New York State has begun to access different waivers that let SNAP kind of stretch further and do more things. For instance, it wasn't signed into law yet, but in the state legislature, they had passed in the Assembly and Senate for you to be able to use SNAP on hot and prepared meals if you're a senior, differently abled, or unhoused, right? So that's an example of something that can be done on a state level, and only about a dozen states do that. New York State has also made it easier for college students to be able to access SNAP just from taking you know, a certain amount of hours of technical education or training. So there's things that you can do locally to make sure that more people can access SNAP. And in order to make a sort of longer impression, it's really about locally being that voice as shown what's possible, so that when the Farm Bill happens, they can say, okay, we know that SNAP only provides about, and I'm drawing a blank on it, Nick might know, but SNAP's only about like $1.40 per meal, when we know that food costs a lot more in New York City per meal. So it's not really reflecting the true cost of food. So a lot of work needs to be done to make sure that SNAP stretches further so that all the benefits aren't used by the third week. And I'm sorry, I'm listing a couple of things from the Farm Bill, but also in the Farm Bill, and this is like less than 5% of the Farm Bill, there's this grant program called the Community Food Project. And that's something that provides funding for community-based organizations, nonprofits, even like tenant associations to do their own food access programs. So imagine if we just got money in the hands of people that have these great innovative ideas on how to feed their community. Yeah. That would go a really long way, but it's something that's not really funded as much in the Farm Bill.
But we have access to those grants. Is that what you're saying, Jerome, that there is community opportunity to access that grant money?
Yeah, exactly. Like that grant, there's only about 12 or 13 awardees a year through that grant program. And that's, I mean, we have 50 states. It's not even enough for one organization in each state to get a grant like that. But I just bring that up as an example of how there's like these great models out there and kind of structures, but it's just not big enough or it's not getting enough attention. Folks have used that particular grant to start community food cooperatives, for instance, or CSAs or food hubs. So, you know, that's just an example of how there's a lot of things out there, but unfortunately they tend to be underfunded or there's just not a lot of attention given to them.
Mm-hmm.
I just want to add something too from the point of view of the healthy retail that we were doing. Delis, you know, the smaller stores, I think the state was trying to shut down a lot of the WIC WIC access and a lot of the SNAP access in the smaller stores because they were claiming that people were, you know, using SNAP to buy cigarettes. What was happening though is so they're trying to shut down the WIC stores. But also if a store was caught selling cigarettes to somebody who was underage or beer to somebody who was underage, instead of just saying, well, you can't sell beer, you can't sell cigarettes, they would take away their SNAP. And to get SNAP back is a $30,000 fine. And the delis, they can't afford that, so they just do without WIC and SNAP. There was one store on Port Richmond Avenue, a little Mexican deli. They were making like $100 extra a day selling vegetables using SNAP, which was cut off because somebody came in and bought, one of the city inspectors came in and had somebody underage buy cigarettes or something. So that store no longer has SNAP. And the people who want to go to that store and buy vegetables, Mexican vegetables, you know, a specific kind of food, they can't do it.
I want to jump in here and just piggyback on that idea, which is sometimes we do hear this term about fraud, waste, or abuse in the SNAP program, and the reality is that that's a lie.
Mm-hmm.
It is one of the, it is, when you look at federal programs and fraud, waste, and abuse across the federal programs, it has some of the lowest rates nationally of any program. So it's incredibly effective, it's incredibly efficient. And when there are instances of that being a problem, it's almost always at the retailer level. It's not at the household level. So to jump back to that idea and sort of what our opportunities are as you know, as New Yorkers, part of that is telling that story and say, nope, that's not how that is not. And so being informed about those types of things and amplifying the great opportunities that New York City has in terms of using SNAP benefits in a more flexible way. So an awesome example of that is being able to use them at Grow NYC markets. You get double up bucks, right? You get more bang for your buck at green markets. That's really awesome. We're running some pilot programs in New York State, across the state, to be able to allow for SNAP benefit use for online grocery store purchases. There's a lot of logistics involved there, a lot of other considerations, but you know, I think core to our policy values is that the flexibility and choice and the dignity and effective and efficiency that comes with that are the things that we should be pursuing. So I just want to kind of amplify those things.
Mm-hmm. Thank you. Thank you all so much.
Okay, Mike, what's your question?
Then speaking of other incentive programs, the city did a fantastic pilot called Get the Good Stuff. And in the 10-year, the mayor's office of food policy and the 10-year food plan, it's mentioned that they'd like to see that continue, but if that could receive more funding and get into more stores, the pilot was sort of limited to just a few stores. And basically it's an incentive card that you can use to purchase healthy items like fruits and vegetables. And then also through the pandemic and the use of the pandemic EBT cards, every retailer in all across the city were delighted to have that extra $420 coming into their stores for people to purchase food, as well as just the increase, the pandemic SNAP, just the increase in raising the SNAP amounts for families. So, I mean, and these are all things that can happen through the city council and through city government as well. So, like not the SNAP, but the incentive programs.
Don't forget also that many families have shied away from SNAP in light of changes in federal policy regarding immigration and SNAP for American-born children of immigrants who may need to change their status or in the process of receiving a green card. Prior, SNAP wasn't used as a measure of a person's financial competency in the United States, and that changed in the past administration, and that really sent a cold chill over people, and people stepped back from registering for SNAP, applying for SNAP for their families. I'm hoping that'll change now, and I don't know exactly where things stand at the federal level, but that did have an impact on SNAP, and we have to somehow figure out a way to in the long run, not touch SNAP or use it in any way as a tool against immigrants who have American-born children who can end their food poverty by being able to use SNAP.
Jerome?
Yeah, Terry, I'm very glad you brought that up, and sorry I didn't think to talk about access, especially for immigrant communities, but just to touch on that a bit, what Terry's talking about was a proposed rule called the public charge. And under the prior administration, there were at least 4 different rules that were proposed or being drafted that were really intentionally designed to make people lose their eligibility for SNAP or to scare away immigrant communities. It was almost like a wealth test because it would be considering this totality of circumstances when they're thinking of when you're trying to safely and legally become a citizen. However, that rule actually did not go into effect, thankfully. And it was held up in the courts for quite a while. And then by the time the Biden administration came in, I mean, they pretty much had removed the public charge rule entirely. So thankfully, it's not in effect, and immigrant communities are legally safe to, provided they're eligible to access SNAP. However, to Terry's point, there's the chilling effect. So a lot of immigrant New Yorkers disenrolled, even though that rule wasn't technically being applied to them. I mean, even some foreign-born New Yorkers that were already citizens, because it was so confusing. It was a 1,000-page rule. And I think that really where the city comes in and where they stepped up at different stages, and we were able to work with the Mayor's Office of Immigrant Affairs on it, is to really combat the chilling effect with outreach at emergency food providers, having a hotline through Moya where people could call and kind of get the details on their specific case. So I think that really kind of underlines another spot where city government can do more to really provide that resource outreach to marginalized communities, immigrant communities that might be getting misinformation or not aware of the different things that they're eligible for, especially in the food space.
As well as dispelling myth, I would think about the sort of the misinformation about fraud, abuse, and sort of other tropes that that prevent more buy-in from other parts of the community.
Mike, you still have any questions left?
Yeah, I was going to say, sometimes I benefit from being alphabetically last, and this is not one of those instances. I'm used to it. I always was on the end of the line in school. I was always the tallest kid, so I'm used to this. But so 2 of my questions were stolen. Luckily, I have 3. The first was going to be, what does city funding, reservoir funding, actually help? You know, the delegation gave $162,000 in funding this year, last year to groups, and the 5,000 allocations usually require as much paperwork as the 25,000 allocation. So that was my question, which Nick answered really well. My second question was, how do we best get information out to constituents about better access to food? And that was answered by Nick too. So Nick, maybe you're going to answer this question for me. This is probably the only group that I've sat in where people have actually talked about how government does something really well. Now, having been in government, I know that that's actually the case in a lot of instances, but it's not a popular notion. So, and one of our leading contenders for mayor is talking about how she led, 1 million meals a day during the pandemic. And so my question is twofold. Are there things in the existing city infrastructure and this existing city resources that could help your organizations do your work better? That's not something you normally would ask. But in this instance, because there's so much conversation about government being helpful, where could the council member's office help leverage? The second part of that are there ways to find inefficiencies amongst the nonprofits that are doing things in this realm? And are there duplicative efforts that are happening that if the council member's office were to bring everybody around the table, we could find some places where you could save some money so that more money can be spent in other places more efficiently? So 2 questions: where can government help? And where can each other help you to find the resources to do your work more efficiently?
It's a good one.
I won't start this time.
Well, you took 2 of my questions, so you might as well take the third.
Well,
yeah.
No, go ahead.
I'll say very briefly, and we can follow up. But okay, in terms of inefficiencies, I think every nonprofit in New York City is, especially in our space, and if you, this space is very under-resourced. The reality is that over 1.5 million New York City residents are food insecure. The resources that the city commits to this efforts are really essential, but they're also pretty small. So in terms of finding efficiencies, I think we're talking about operating in pretty bare bones budgets oftentimes. So that's a hard thing to identify. I do think that the more that we leverage the existing community-based organization infrastructure, instead of standing up new programs, you know, there are some situations where standing up brand new organizations and things like that might be an effective way to triage it. But I think that oftentimes, you know, the power of community-based organizations is in part their community reach. And I think Staten Island in particular is really, really amazing and really special in their ongoing coordination on, I mean, this forum is often around policy, yes, but also coordinating on programmatic pieces and things like that. So there's a lot of strength in that. And I think that in terms of identifying places for council offices in particular to interface with those organizations through referral mechanisms, through being trained, through, you know, being in touch and building those relationships, continuing to build those relationships. I think those things come to mind for me.
Mike, what was your first question?
My first question was about what kind of existing city infrastructure, city resources can be leveraged by the council member's office to help you all do your job. And Nick, I will follow up. It's a really good answer. The idea in my mind when I asked this question was there a way that the city as a market maker in terms of the purchasing of food in bulk, could the nonprofits do that in some instance? I know the city did it when they were purchasing for during the pandemic. And so because of that sort of large scale purchasing, the prices actually go down, which means that the purchasing power goes up. Is there a way to leverage that? As that's what I think of when I think of efficiency. I know that staff are underpaid, under-resourced, you know, all that. I was sort of thinking more along the lines and sort of market in the markets.
Yeah, that's a great question too. So the city does do that. The city's emergency food assistance program, for those of us who are doing this work, we call it EFAP, EFAP, does do that. In fact, the city procures the food directly and leverages their buying power. And then we, Food Bank for New York City, in turn, does the order fulfillment and delivery. So they are doing that. And there are some opportunities to scale that. I think what's one important piece to this is that the more that we can build flexibility and choice into that procurement, into what's procured, the better. Agencies can talk about this more specifically, but these are sometimes slightly less flexible than other types of funding where agencies have some more choice. So yeah, I think funding that type of work is important. The city is doing it. You know, we at the procurement level do also have a significant buying power, and we often can get really good prices. You know, when it comes to the school food, we haven't talked about school food actually on this call, but it's actually a really important thing. You know, nationally, I think we can say that we want to have universal free school meals. The city has some restrictions in terms of how it can procure food. So advocating for federal policy changes to make that procurement more effective. You know, the obvious thing is the reimbursement rate, but there's a lot of less obvious things which have to do with allowing for smaller purchases. Basically, the city is bound by having to make these massive purchases, and the more flexibility that is built into the child nutrition reauthorization at the federal level, the more effective school food can be in having choice. Their menu patterns also have some prescriptiveness to it that would benefit from some more flexibility. I'm not an expert on school food, but the team at, I guess it's the New York City Office of Food and Nutrition Services is really keen on advancing some progressive policies, and they're working with advocates across the city to make that to make some of those changes, to actualize some of those changes in the next child nutrition reauthorization. So I think that's a really, really good point. I don't know, that's my perspective. Maybe other folks have some other ideas.
I would just add that to Mike's question, you really need a city process. You need a city agency that is designated to distribute funds to food pantries, and then an RFP process to write the grant to get the funds for ongoing infrastructure. Leaving this to the discretion of the city council members I don't think is an effective way of doing it. Actually, in this pandemic, we've never been able to get food money from the city of New York for food pantry. In the last maybe 4 years, we got $22,000 a year. And in this pandemic, it went down to like 9,000. And I had to beg and piece together things and grovel and meet with every current city council person on Staten Island and explain about South Shore poverty and explain about Mid-Island poverty. And basically the only person that was interested in helping me was the 49th Council District. The perception that it's a North Shore problem, the perception that it's a problem in communities of color only, the perception that this will cure it for the whole of Staten Island is not true. But create an objective process where you prove what you need so that you can apply for the infrastructure funds, both capital and ongoing staffing, and put an amount of money in the budget. $162,000, if that's what came to Staten Island, is chump change for what is needed. So that's what I would do. Get off the dime and create the infrastructure to give us the infrastructure.
I just want to add something. When we talk about food insecurity and homelessness, I think that that's sort of abstract. And I think that all of us have known somebody who's been living in their car. That's somebody who's homeless. And I think we all know families where mom doesn't eat dinner so that, you know, the kids can eat. You know, this is happening now. Was it George was talking about the Berry houses? The West Brighton houses, they started a food pantry for the same reason, that their seniors were eating cat food. So they've been, you know, putting food outdoors in the cold, in the rain, distributing food. I think now they're up to 3 or 4 times a month, just to keep that from happening again. You know, so this it's hidden, but it's there. You know, and we're maybe not seeing what it is personally for people. And people who are living in their cars are not eating because they want their kids to eat. You know, maybe they're not even seeing themselves as homeless or as food insecure, but we can recognize it and try to address it somehow.
Am I allowed to ask a second question or no? I don't want to go over my. It's okay if not. I'd love to follow up. This is really an amazing call, and I absolutely want to change this perception in the South Shore. I just wanted to say that publicly. So, but if I'm allowed to ask another question, let me know.
Does anybody have questions for the candidates at this point?
Susan?
Yes.
I don't know if you heard or you wanted to respond, but Olivia asked if she could ask another question before we went into the.
Oh, yeah.
I was wondering.
I didn't hear.
Oh, I'm sorry. Thank you, Lorie. I wanted to ask if the community school aspect, I know that there is support for pantries through community schools, and there's been a push in the city council for making every school a community school and funding for that. And that's absolutely something that I support. Have we seen that support the neighborhoods like, you know, Curtis High School becoming a community school? Have we seen that become a major hub? Is that doing the job? Do you think community schools might be something that advocating for them in these places where otherwise stigmatization of food insecurity is an issue? Do we ever see that kind of becomes a good center for the community? Not the best well thought out, but community schools, has anyone have any reflection on that?
Daniela, do you have, or Mukami, you're in that space kind of, do you have any thoughts?
Oh, sorry. I was gonna say at this time, I'm not too sure. So I can't really add to that at the moment, but it's definitely something that's of interest to kind of investigate on our end.
So I, just taking a shot at this. So not necessarily from the emergency food lens, but from City Harvest programming with our culinary education. We found that it was incredibly easier to work with community schools. In fact, most of the schools that we worked with before COVID, when we were doing culinary in person, were pretty much mostly community schools. And one of them actually, around my way in Clinton Hill, we started to work on building out a pantry there. And that's just to say, I don't know if we tried doing it with regular schools, but I just found that those community schools having like a nonprofit based in there, like Zone 126 in Astoria or Global Kids we've worked with, have made it easier for us to kind of do more.
I think that's true on Staten Island too, at Curtis and at Port Richmond High School.